So good morning. For some of you, good afternoon. We're looking forward to a very informative webinar on the meaning of social health. We know that typically we think of health as our physical or mental health, but we rarely add that third pillar of social health, and how social health through our connections and community actually contributes to our health and to our longevity. So this webinar is about a topic that is not typically in our repertoire, but I think is one that, thanks to the work of WHO and PAHO, we have been sort of brought to date, have actually brought it to a forum that is loud and clear. In this webinar, we will hear about the difference between meaningful relationships and simple contacts. We're going to learn about the quality, not the quantity of our connections. And we will learn how a sense of community, how connections within a community are important to health. The webinar is offered as collaboration between WHO, PAHO, and AFSM. AFSM is the Association of Former Staff Members of PAHO. So specifically, the Committee of Healthy Aging of AFSM has been working to keep our members informed and engaged in the business of healthy aging. As a member of the PAHO family, we not only are beneficiaries of the work of the Decade of Healthy Aging, but we feel very strongly that we are also collaborators in that journey. So we will begin with a few words of welcome from Patricia Morsch as a Regional Advisor of Healthy Aging at PAHO. Unfortunately, she's traveling for work, so she's unable to join us live, but we have a short video with her message. So Brenda, if you bring Patricia.
Hello, everyone. I am Patricia Morsch, and I'm really glad to be here today. I'm sorry I couldn't join live, but I'm grateful for the chance to share a few words on this important topic. As PAHO Healthy Aging Advisor, it is my pleasure to welcome you to today's webinar and to once again collaborate with AFSM in this important event. This webinar series has been very relevant to us as it allows us to connect with other people, providing them with useful information and engagement as we advance in the decade of healthy aging. Today's webinars on the strategies building social connections after retirement provides critical information as social connections are increasingly recognized as a key component of our health and well-being. I want to thank you all for your participation, which demonstrates a shared commitment to improving the lives of other people, which is the central goal of the Decade of Healthy Aging. While social connections are not explicitly listed at one of the 4 action areas of the decade, they are embedded across all of them. They influence how we change attitudes toward aging, especially when we consider intergenerational activities. Social connections are at the core of creating age-friendly environments, and they play a vital role in the delivery of integrated healthcare and long-term care, not only through their direct influence on health and well-being, but also by supporting older individuals in keeping up with their health appointments and interventions and support when needed. In other words, fostering social connectedness is a core element of supporting healthy, fulfilling lives for older adults. At PAHO, we are committed to continue to providing technical cooperation in healthy aging and encouraging countries in our region to strengthen social connections for older people across the life course. By doing so, we can build more cohesive societies, increase participation, and foster intergenerational solidarity. I wish you all a very productive session. Once again, I would like to thank AFSM members, Martha, and the Healthy Aging Committee for their commitments and active participation in advancing the decade of healthy aging in the Americas. Thank you.
Well, thank you, Patricia. And those of us who have retired a few years ago, we know the challenges. We know how disruptive that event can be. Not always true, but it can be, because it really disrupts our everyday social structure, which was centered most of the time in work, or in family, but work was very central to our connections. So, after retirement, how do we reestablish our social network? Has to be done in a more intentional fashion. And what is true of retirement may also be true of widowhood, or may be also true of geographical relocations. And for some of us, all of those things happen almost simultaneously sometimes. But the good news is that we can do it. We can reconnect, we can reestablish, we can begin to develop new connections. And the fact that the WHO has been paying attention to how important that connection to a social network is, especially as a driver of healthy longevity, we have been sort of refocused on why and what's the meaning, and what are the ways in which we can actually assess, evaluate our own social health. We're fortunate that we have Dr. Kazuke Yamada, who is the technical officer at the Department of Health Determinants Promotion and Prevention at the World Health Organization. He's responsible for advancing WHO's work on social connection, a health topic, as we have seen, at the core of social health. The under-recognized third pillar of WHO's definition of health, alongside physical and mental. So to do that, to really how would you say, no, it's not resurrect, but to highlight the importance of social connections, the WHO created the WHO Commission on Social Connection, led by Dr. Kazuke, and they recently published its flagship report, which we're going to really learn more about that today. I hope that after you listen to him, that you decide that you want to become an active member of the global network of advocates and professionals working in the area of social health. We really need to make that our goal. Sorry, I'm going to put so without further ado, I'll pass the microphone to Dr. Kazuke and turn mine off so you can.
Hello, everyone. Can you hear me?
Very well, loud and clear.
Fantastic. First of all, before I put my PowerPoint on, since this is about social connection, let me first talk to you a little bit face to face before my screen becomes smaller, right? First of all, thank you so much to Marta and Patricia and to everyone at AFSM for this invitation. I'm really delighted to be here. And as Marta said, this is probably a slightly unusual topic to be talking about, but I hope that through this webinar, we get to learn a little bit more about why loneliness, isolation, and connection has been a growing issue from the perspective of public health, from a lot of member states' perspectives, and really try to have a very grounded discussion on this topic, because unlike a lot of topics that we might deal with in WHO, this topic is very personally relatable. We've all had moments where we felt connected or felt disconnected or felt lonely or isolated. It happens as a natural part of everyone's lives. So as we go through this presentation, I really want all of you to not only think about this topic in an abstract sense, and thinking about this topic also in the sense that Marta was talking about, in terms of how it impacts your current stage of life, but your personal experiences with it through your life so far, because the things that I will talk about today really relate to what everyone goes through in their lives. So without further ado, I'm going to share my screen. I'm going to be talking today about how social connection, social isolation, and loneliness impact health and well-being. And I'm coming from the perspective of WHO, of course, but also from the perspective of the Commission on Social Connection, which Marta talked about briefly, and I'll go back to later in the presentation. As I was mentioning, unlike many public health topics, this one touches every single person's daily life every day. So for a group of people who have been actually through one of the biggest social transitions there is, which is retirement from an organization that structures your social world, your daily rhythms, right? So much of our time is devoted to work in a way. So this social transition can cause a lot of disruption. And this topic, I think, is particularly relevant when it comes to that. So in this presentation, I'm going to share the evidence for around 20 to 25 minutes. But as I said, I will very much encourage you to think about your own experiences and personal experiences as you go. And then the panel after me will bring that personal dimension to life. Let me begin from what many of us may be familiar with in broad terms, but perhaps it's worth revisiting because there's something that we've all, or at least I have, forgotten in recent years. As you know, the WHO Constitution underpins the work of the World Health Organization, and in that constitution, there is a definition of health. This definition of health has been part of all of our working lives, for decades, years, and months. And it says that health is a state of complete physical, mental, and social well-being, and not just the absence of disease or infirmity. A state of complete physical, mental, and social well-being. And we've made a lot of progress in terms of building entire health systems around the first two pillars. Physical health, which has, been considered the bread and butter of WHO in a way. Mental health, increasing attention has been paid to in recent years, realizing that it's an essential part of well-being. But the third pillar, social well-being, for some reason, despite the fact that it's been part of WHO's definition of health since the very beginning, 1948, we've kind of forgotten this pillar of health. But as we all know and experience, during the COVID-19 pandemic, we suddenly remembered, and countries remembered, and physicians remembered, and everyone remembered the fact that social connection is an essential part of our well-being and health and quality of life. And the fact that we had to physically distance from ourselves in order to, deal with the pandemic, rightly so. Nonetheless, that still led us to feel, what is life if we cannot connect with people in the way we used to? And so governments and everyone else woke up to the fact that actually social well-being as social animals is essential to human health and well-being. We don't ask patients about their social health. We don't measure it routinely. And yet there is now growing evidence and very solid evidence that shows us that it matters just as much as physical health and mental health, and in fact is a core component of both of them. So the report that we wrote together with the Commission and the facts and evidence I'm about to show you today, that's what it's about. The WHO Commission on Social Connection set out to make the case for action, to convince you with evidence that social health deserves the same attention as physical and mental health. And as you'll see later in this presentation, the evidence is really, really quite convincing, and I'm hoping you'll agree with me. Let's first start by definitions, which is quite important because loneliness, connection, isolation, these are words that are very familiar to us. but we have to make sure we're talking about the same thing in order to proceed in the right way. This is the scientific approach. So let me start there. Social connection is the umbrella concept that we're dealing with on the positive side. Broadly speaking, it's defined as all the ways in which we relate to and interact with others. It has three dimensions. The first is structure, which is a numbers game. How many relationships do you have? How often do you see them? This is an objective sort of measurement of relationships. The second dimension is function. What role do these relationships have, or what support flows through these relationships? For example, can you call someone when you need help? Do your relationships give you emotional support, practical help, information? This is partially what people refer to when they talk about social capital. It's about the resources you can access through your relationships and what your relationships specifically have to offer. You could be a teacher for someone. That is a teaching relationship. You could be a mentor for someone, or, you could be even, in a working relationship. So it's the type of function that the relationship has. And then the last dimension is quality. How do those relationships make you feel, and how good are those relationships for you? Just because you have a parent-child relationship doesn't mean that that relationship is always good or bad. There is a particular quality component to the relationships that you have. So social connection, broadly speaking, thinking about how we relate to and interact with others, is composed of these three dimensions: structure, function, and quality. Now, on the other side of social connection is the broad term called social disconnection, which is the opposite of social connection. Within that broad category, I will be talking about specifically two types of social disconnection: social isolation and loneliness. There are other types of social disconnection, but we're not going to deal with that at the moment because actually isolation and loneliness are the most studied types of disconnection. For isolation, this relates directly to the structure component of social connection. It is the state of having very few relationships or not seeing people often enough. So there's no agreed yet number or threshold of how many is enough. So that's still under debate in the evidence, but this is purely based on how many relationships you have and how often do you see them. You can count it, you can measure it. It's an objective measure. Loneliness is a subjective state, and this refers to the difference between what you expect from your relationships and what you actually have. And this can be measured along any of the dimensions of social connection: structure, function, or quality. If the relationships you have is not enough in terms of numbers, or it's not enough for you in terms of the function they offer you, or it's not enough for you in terms of their quality, or a combination of all of that, that causes a psychological pain within you, and that causes health and well-being consequences. The reason why differentiating this is so important, it's because interventions that work to improve social connection is not the same as interventions that work to reduce isolation, and that is not the same as the interventions that work to reduce loneliness. At the same time, the health consequences that I'm about to summarize for you, loneliness has different effects on health, isolation has different effects on health, and connection has different effects on health, which is why it's so important to separate these things, because what might work to reduce loneliness is not necessarily the same as what works for isolation. So these are all different things, and I want to go with a very concrete example. Someone can be isolated without being lonely. For example, many of us might prefer solitude. You don't need that many relationships. You enjoy being by yourself. That means that you are isolated, maybe, which put you at risk for particular things, but you don't necessarily feel lonely, and you may not necessarily experience the negative health effects of being lonely. At the same time, you can be connected to a lot of people. For example, celebrities, social media influencers. In this age of the digital world, in some cases, many of us are more connected than ever before on the surface. But that can still mean that you feel lonely because the relationships and the connections that you have is not enough based on what you want. So it creates these paradoxical situations where you can be surrounded by people and still feel lonely, or you can be not surrounded by anyone and still feel not so lonely. Both matters for health, but they work through different pathways. So I've defined connection, loneliness, isolation, but is it a problem? And let's start with how widespread the problem is. Yes, loneliness is a global problem. Loneliness affects at least 1 in 6 people worldwide. That's roughly 16% of the world. They report feeling lonely. And an additional 2 facts may surprise you, but there will be, a caveat afterwards. What we found based on existing data and surveys is that the highest rates of loneliness only is actually amongst younger people. So around 21% of adolescents report feeling lonely, the highest out of any age group. And the second fact is that loneliness is more common in lower income countries, with the WHO African region reporting the highest rates of loneliness, around 24%. So the assumption when it comes to loneliness actually is quite interesting from the perspective of stereotyping. A lot of people assume that older people in high income countries are the most lonely in the world, but the data suggests that that is not necessarily the case. We still need to understand why the data shows this, but the data is showing this. And there's a big but here, very relevant for this conversation is that the other side, which is why definitions are so important. That was the case for loneliness, but it could look different for social isolation. And according to the Commission's report, 1 in 4 older adults are estimated to be socially isolated, not lonely, but socially isolated. And based on the data that we have, this is the age group that experiences the highest social isolation. This is really interesting, right? And even, if you look at the age stratification, if you look at the oldest old, over 80 years old, the figure may be as high as 1 in 3 people feeling socially isolated. So why is this the case? Why is there a data that shows that younger people are more lonely, but older people are more isolated? We don't know for sure yet, but there are many hypotheses we can raise. For example, it makes sense, for example, in the current state of what supports healthy aging, that in many countries and environments, later life brings a couple of situations that tend to shrink social networks. You might have experienced many of this before. Retirement means losing daily contact with your colleagues who may have previously been people you interacted with the most. Bereavement, health problems that may limit how you can meet people, moving to be closer to family, or family may be moving away from you, children leaving, becoming a caregiver. Later life brings a lot of life transitions that may be, drivers of becoming socially isolated. But on the other side, many older people internalize ageism, and maybe they expect that your social networks will become lower. And remember what I said about loneliness. Loneliness is a psychological feeling that comes from expectation. So if you expect your social networks to become smaller, perhaps you will not experience loneliness as deeply as others because the expectation is low. However, that's not necessarily the case. I'm not necessarily saying that older people should have less social networks, right? It's just one hypothesis that perhaps internalized ageism about what older life brings could be leading to lower levels of loneliness. But at the same time, as you grow older, there are different types of relationships we look for. Many of you will be able to relate, for example, that older people want to contribute, as they grow older. This is called generativity. Or they want to feel valued and actively included as society, as they start to experience the effects of ageism. So it's clear that older people are looking for relationships and particular types of relationships. So this difference between isolation and loneliness as different age groups is still a puzzle that we need to unlock together. Let me move down to the drivers of social isolation and loneliness. So I just explained that loneliness and isolation are widespread, a global problem, experienced by everyone, but experienced in different ways. So what then causes isolation and loneliness? So this is not a comprehensive picture because a lot of research is yet to be done, but these are some of the major drivers that increase the risk of experiencing isolation and loneliness. I've talked about a few of them already before. Life transitions, like moving from home, moving places where you live, retirement, when your family move away or move closer to you, caregiving, etc. Poor health, when you are less mobile because of your health issues, you can't go out to meet people. Living alone, which happens to a lot of older people, unfortunately. I talked about a few of these, but I want to highlight 2 additional ones that are particularly relevant to this group. And the first one is marginalization. of all types, whether it's ageism, ableism, sexism, racism, all of those types increase the risk of experiencing isolation and loneliness. And ageism is obviously a driver of isolation and loneliness, but also because one of our panel members later is going to talk about gender, I want to highlight gender specifically because this is also a way of experiencing loneliness and isolation in different ways. In a major report by the OECD last year, they found that men are a particularly emerging risk group for social disconnection. So men's loneliness has been increasing the most out of between the two genders. And men are more likely to report having no one to share their private worries with. And 13% of men globally say they have no one to help them if they were confined to bed, which is less than around 10% of women. So gender also shapes the way we experience isolation and loneliness. And recent research is suggesting that perhaps men experience isolation and loneliness more deeply and more commonly currently. The reasons for that is still unclear. So that's one issue. And then also digital technology. I wrote here unhealthy use of digital technologies, which is very important. Because for younger people, the issue might be about harmful overuse of digital technologies. But for older people, for many older people, particularly old people that don't live with their family or things like that, digital technology can be a genuine way to keep connected with the people you love. So it's really important. But at the same time, many of you are aware of, scams and the way digital technologies can victimize older people. And there's really a harmful use of digital technology and a healthy use of digital technology. And we need to make sure we focus on the healthier side rather than amplify the unhealthy side of digital technologies. But they are shaping how we live in the world, including how we connect with other people and with each other. And so we need to be quite careful about how digital technologies are transforming the societies in which we live. So I talked about how widespread disconnection is. I talked about what causes disconnection. And this is probably the most impactful or attractive or sort of engaging slide that I have. It's about the impacts because today, we're talking about the health impacts. And these are the impacts that really surprise a lot of people and convince them that loneliness and isolation is not just a soft issue. It's like, oh, you feel lonely, but that's just an emotion. That's just something you feel. That's not true anymore. We know for sure that loneliness and isolation cause concrete physical, mental health impacts. So they harm physical and mental health. Loneliness and social isolation is associated with a 29% increased risk of coronary heart disease. Isolation carries a 32% increased risk of stroke, and loneliness and isolation increases the risk of type 2 diabetes. Disconnection increases the risk of cognitive decline by almost 50%, so dementia. People who are lonely are twice as likely to become depressed, and older adults who are lonely are twice as likely to have suicidal ideation. So there is a clear connection between the state of being isolated and lonely and concrete physical and mental health outcomes. It could not be even clearer if I go to the life expectancy. If one feels lonely, you are linked with a reduced life expectancy with up to 871,000 deaths per year, which is linked to loneliness only. If you include isolation, which we haven't done yet, probably the death rates are higher. That's 100 deaths per hour that can be linked specifically to loneliness worldwide. But I also want to emphasize the other side, right? Disconnection harms health and well-being, but connection is a protective factor. They can lower inflammation, protect the brain, extend your life. So this isn't just about risk. This is also about the health benefits of staying connected and and maintaining the connections that many of you are actively trying to maintain. But beyond individual health and well-being, I also want to emphasize that there are broader impacts in terms of education, employment, community, and costs to the economy. So it's not just about your own health and well-being. It's about the health and well-being of our communities and societies. We only have a few estimates from a few countries where studies have been done. But for example, in Spain, it's estimated to cost 14 billion euros per year. In the UK, it's estimated to cost $3.2 billion to employers because lonelier people, perform worse at their jobs and keep jobs for shorter times. And in the US, the costs are estimated to be $6.7 billion to Medicare through the costs of the health outcomes that are generated through loneliness and isolation. And these are really not small numbers. And you can even imagine what the estimates might be if we expand the estimation to a global perspective. So far, it's been quite, a dreary perspective. Loneliness is widespread, it causes negative impacts, and it, affects all of us in different ways. But the good news from our report is that solutions also exist to strengthen social connection. And I will talk about all of these campaigns, policies, community strategies, and individual strategies. But I'll try to focus a little bit more on number 3 and number 4, because I know those are the elements that you're a little bit more interested in. But I also wanted to talk about 1 and 2 because it's important as, WHO family to keep in mind the global perspective as we go down into the individual. Okay. First of all, advocacy campaigns, networks, and coalitions. At the broadest level, this is a new topic. Many of you have probably come to this webinar thinking, why are we talking about connection? This is not a health issue. This is a new framing and a new perspective with a lot of evidence means we can no longer ignore it. But a lot of people still need to be convinced to be thinking about this. So at the broadest level, we need to raise awareness and shift norms. And the fact that this webinar exists and the fact that the AFSM has dedicated a session to this topic is an act of advocacy, and I'm really grateful for that. But after this webinar, I hope that all of you will carry this information with you to your communities, to your families, to your organizations, and begin talking about the importance of social health for health and well-being. One of the most important things that advocacy does is reduce stigma. For example, the OECD found that men underreport loneliness because they feel ashamed to admit that they are lonely, right? So we need to create safe spaces where it's acceptable to talk about feeling disconnected in the same way as we started creating safe spaces to talk about mental health more broadly. This is the first step. In terms of policies, because many of you came from WHO, I want to talk about the sort of global country context. Right now, as of the writing of the report, there were only 8 member states in the world that have a policy, strategy, action plan, law, or advisory on social connection. That's Denmark, Finland, Germany, Japan, Netherlands, Sweden, UK, and the US. There's only one country in the Americas, the US, and there are no countries in the Americas more broadly, no countries in Africa, and no countries in the Eastern Mediterranean or, Southeast Asia that has a policy on loneliness and isolation. So this is a very early landscape, but at the same time, we're choosing to treat it positively. Countries have shown leadership and are already acting to implement policies on social connection. The one thing I wanted to say, in addition to that, is that all of these policies take a whole of society approach. So they're not just health policies. They're policies that include social affairs, education, urban planning, labor, etc. So the thing I wanted to emphasize from this slide is that although the case for action is very much rooted in health, if it's only the health sector that acts, change will not be possible because a lot of the levers for change exist in other sectors. And then the more interesting stuff for the purposes of this webinar, community strategies. And we know for sure, based on the evidence, that strategies implemented at the community level is the most effective when it comes to reducing isolation and improving connection. We know that it will be the most effective. Unfortunately, not all, actually most interventions at the community level that tries to address isolation and loneliness, they are not studied and they're not evaluated. So we don't have the type of evidence that WHO usually looks for to be able to strongly recommend specific types of community strategies that are proven to work. However, we have some ideas, right? Social infrastructure, parks, libraries, community centers, public transportation, third spaces, the physical spaces within a city or community where connection happens. This is really important. When you close libraries, when you close buses, when you don't provide public transportation, when a community center loses funding, social connection suffers because you need these spaces to connect with people. And for older people in particular, walkability, transport, these are critical to be able to go out and meet the people you care about. And if you can't get to those places, you deepen disconnection and isolation. Social infrastructure is so important, but we have limited concrete, public health, peer-reviewed evidence to show us this. Community groups. This is the engine of social connection, volunteer organizations. We're going to hear about the role of faith and faith communities, hobby groups, neighborhood associations, associations like this one, Association of Former Staff Members of WHO. These are really important groups where they are the infrastructure of social health, and we really need to have them. And then finally, a little bit of a public health slanted category is social prescribing, where primary health physicians will prescribe, a local community group or an opportunity that is being offered by the local government in terms of social groups. They will prescribe you to join these networks if you are expressed feeling loneliness or isolation. And some countries like the UK and Singapore are really leaders on this in involving the health sector in helping them in using them as connectors to community groups or social infrastructure opportunities where they can feel more connected with others. So the evidence is still growing there, but it's looking like a promising intervention. And then finally, what can you do individually on your one-to-one perspective and with the relationships that you have with the people around you? These are the more promising interventions. Others may yet exist, but the evidence doesn't exist yet. So skills training, how to, befriending programs or how to use technology to maintain your relationships, video calls, WhatsApp, online communities, learning the skills you need to maintain connected can be a very effective way to access social connection. Social engagement facilitation. So befriending programs, peer support groups, intergenerational activities and networks, and even non-human companionship, pets, and sometimes even robots in some countries, they can also help improve on the individual level connection. And finally, you may be expecting this given that social isolation and loneliness is very closely linked to mental health. Therapeutic and psychological interventions have a lot of evidence behind them, things like CBT, cognitive behavioral therapy, psychotherapy, clinic, actually going down and sort of sitting down with a psychologist to talk through your problems and identify issues. Those also have a lot of evidence behind it. But just keep in mind that just because an intervention has a lot of evidence doesn't mean that it's the only intervention that we should be thinking about. CBT is a very well-studied form of intervention. It has a lot of evidence, but also because of that, it's easy to model your study according to other studies that have shown and studied CBT. Other types of interventions, like how does a road, improve your health and well-being through connection, or what is the role of public transport or buses for social connection and health? That's a little bit more difficult to study, and that's why there's probably less evidence on that. It doesn't mean that community interventions don't work. It's simply that there's not yet the evidence required for WHO to say that these are the interventions that work. Okay, I'm going to wrap up quite soon now, but just a few parting words. In terms of the Commission on Social Connection, they identified the agenda forward for the next 10 years. How can we ensure that social connection becomes a recognized part of our public health agenda? There are 5 pillars in that plan. I already talked about a few of them, so I won't go into it too much. Sorry. I accidentally closed it, so I'm going to open it again. Here we are. Yes, so I already talked about policy. I already talked about interventions, measurement. I can talk about in the Q&A if it's needed, but I just wanted to really specify 2 pillars that are really important for this conversation. The first is research, and the second is engagement. On research, and very briefly, I talked about a lot of evidence, data, proof of the impact on health, interventions that are proven to work. But I've also been trying to be quite honest in saying that we have less evidence than we need in particular areas. For example, the role of gender, or additional data on older persons, or research on interventions at the community and societal level. There's a lot of research that is required. So I just wanted to highlight for you that we have a good case for action, but a lot more research is required to really make the case solid. So that's one thing. And then the other thing is engagement. All the policies, all the research, all the interventions won't matter if we don't build public understanding and support. And this is why I talked about campaigns and sort of advocacy and networks earlier. Engagement means shifting norms and each of us becoming ambassador for social health, not only in the way we talk about it, but also in the way we live and support each other, right? At AFSM, we're all about supporting each other. And that's the type of social capital that we need for healthy aging later in life. It means telling stories. It means mobilizing communities. It means talking about social isolation and loneliness regularly and not being ashamed of it. And this is what this webinar is exactly doing, engagement. And I'm really pleased to be here for that. Groups like AFSM, you have a unique role. You understand public health, you have networks, and you also know what it means to go through a major life transition that increases the risk for isolation and loneliness. So you're both the audience for this evidence, but also the people that are best placed to spread the good news around the fact that we're recognizing this as an issue and we have solutions that we can do to address it. So just in terms of the institutional background, you've heard about the Commission on Social Connection many times, but just to give you a short summary, it was a new body that was established by the Director General in 2023. It lasts until the end of this year, and it has 11 commissioners from all around the world, high level, ministerial, big influencers. And the point of the commission was to increase the visibility of social connection as a global public health priority. This is why the commission published the report, and this is why we're always at the World Health Assembly talking about this issue, and this is why we're here talking to you. Our mission is to really increase the visibility of the topic as a public health priority because the evidence exists to treat it this way. So we have, a long time ahead of us. Hopefully the commission did its work to raise the visibility and we'll keep working towards that. But we, really look forward to working together with everyone, including the AFSM, to continue building on the legacy of the commission, to keep talking about connection, isolation, and loneliness as essential public health issues. So we have the report. I'll put the link to the report later at the end of the slide. But just to say that we also have a World Health Assembly resolution on connection. And this is really going to help us have the mandate to keep this work going. And we're going to be building on this as we move forward to make sure that every country in the world prioritizes connection and social health. So that's it. There's a big opportunity ahead of us. The costs of inaction, as I hope I've shown you, is very high, but the benefits are far reaching. And there's something each of us can do at the individual level as well to improve social health. And so there's no reason not to act. The time to prioritize social connection is right now. So here's the link to the report. I'll also put it in the chat and my email address, and looking forward to the rest of the discussion.
Thank you so much. This has been a very good presentation on a topic that many of us really hadn't thought much about. Although we know how important it is in our own individual lives, but we haven't really put it in the context that you helped us understand. So I'm sure there will be questions for you. I'd like to have now the panel sort of talk to the framework you've given us, but more on an individual basis, how they have managed, what have been the barriers, and how do they think about the connections in their own lives. And then after we finish with the panel, we'll open it up for questions to both Dr. Kazuki as well as to the panel members. Does that work for you all? Okay. So thank you to Juan Manuel Sotelo and Carol Collado and Yvette Holder for agreeing to lead us in this conversation, but lead the conversation with some very specific examples of how they have actually moved on in this journey of building new connections after retirement. What have been the barriers, but at the same time, what have been the many opportunities you have had. So I'd like to have the three of you, who would like to start? Juan Manuel, since we talked about gender, and this is a topic that in fact affects, I think, men more than women. I think we have, but I may be wrong. I think men are a little bit more less tied to community connections and more to in their own history to just family and work, but I may be wrong. So tell us about social connections, Juan Manuel, from your perspective. You're muted.
Thank you, Marta, and I would like to congratulate Kazuki for the excellent presentation. You really lead us towards a relatively new subject, and I need to give you a very short background about myself. No, I have been a widower for 15 years. I live alone, and I am retired from PAHO WHO for 10 years. Okay. Now, I have 6 comments for all of you. I think it's very important to continue doing some kind of work. This is number one. Okay, this keeps me, engaged, from the public health perspective, from helping my institution, PAHO WHO, from also I have my own company, consultancy company, and so on. I work in academia, and I'm a member of the National Academy of Medicine in Peru. So all these things are work, and I would encourage all of us to continue doing some kind of work. The second thing is to learn new skills. For instance, I'm learning how to paint better, as well as, another group about creative literature. Okay, so I'm writing short statements and enhancing my skills to write. The third thing is use of technology of communication. This is very important, especially WhatsApp. I use WhatsApp regularly with my children, with my colleagues, to enhance communication, as well as Facebook, Instagram, and use Zoom and Teams quite often. The fourth thing is to be in touch with my children. This is very important. I almost daily am in touch with them. 3 of them live in different countries, one in Canada, the other in the United States, and the other one in Argentina. So to be in touch is very important, and with friends as well. And finally, I have to strengthen the spiritual aspect. Also, I keep my faith in God very high, and I have a plan of life about this spiritual dimension. So basically, these are my 5 things I would like to highlight in this short presentation. And about your challenge, about engagement, I think being the commission, a global body, we can benefit from other regions' experience as well. And if you can provide us the space for networking with other realities, that will be great, as well as looking for partnerships. This is most important, to establish good partnerships, groups that are willing to work around these concepts. And research, of course, urban versus rural is also important to consider, and mentoring. Okay, these are my initial comments. Thank you very much.
Thank you, Juan Manuel. You have actually made a very important point, and that is that when we think of connections, we can think of them in categories, and it's a very good way to go about it. It's not that we are connected, but you have your hobbies, and you have your connections through that. You have former colleagues, and you have your association's connections through that. So you have categories where you build connections, and I think that helps us when we sort of evaluate our own social health, to do that through categories. I think that might be helpful. Carol, how about you?
Well, Martha, I guess first of all, I am retired for too many years to count from PAHO. I am a widow for 7 years, and fortunately, I live with my special needs daughter, so I do not have that absolute isolation that some people do when they live alone and they are older. But my husband was originally from Spain, and all of his family are there. I was a child born when my parents were older, and all of my cousins I'm an only child, and all of my cousins were 20 to 30 years older than I was. So therefore, there's none of that extended family that's available for so many people as they get older and their contacts shrink to mostly family. So when I retired, I did, as Juan Manuel suggested, work for a while. And then I became involved with AFSM and have been for some time now the chair of the Health and Pension Committee and an elected representative in Geneva for one of their committees. So I have a lot of that kind of work that keeps me occupied. But one of the things that Martha asked me to comment on is that I live in a community of about 800 houses. And my next door neighbor, who is now 91, and I began to talk one day about how we would like to age in place in this community. But the community has, as many have, changed a number of times. It's a community that was built in almost 60 years ago. And so it has changed a lot as different kinds of people move in. It was one of the first racially integrated communities in Montgomery County where we live in Maryland. But there are certain next door neighbor and across the street familiar and knowledgeable people about who we are, and we sometimes have a potluck dinner or whatever, but the community itself is very dispersed, and it's both multi-generational, multi-language. At one point in time, there were 80 some nationalities in this community. So we started to say, how can we make this community someplace where everyone of all generations wants to support each other? And as we discussed, a couple of other people came into this, and we had a core group of about 7 people who continued to discuss activities that we might do to make our community respond to the vision of someplace where people would be in a safe, diverse, intergenerational community where neighbors strengthen each other and everyone lives in a relatively congenial atmosphere. And we came upon this model, which exists, I think, worldwide at this point in time, but it's called Village. And the idea of a village, and each village defines their own personality and what they're going to do. But the village, the idea is to support each other. And it was started initially to support aging, and many of the villages only do aging. We decided we wanted to be intergenerational because we think that intergenerational enriches, and in addition to which, that's what the community is. So as we moved on, we were fortunate enough. We've been in formal existence for about a year at this point in time. We were able to find a small grant which helped us to solidify our organization and to look at what we wanted to do. So this first year, we've had a number of social events, a potluck dinner, a game night, a craft night, and those kinds of things to try and attract people so that we would be more than 7 who were interested in this idea. We now have a email list of about 150 people, but there are 886 houses in this community, and we know that we need to find out more, and that's one of our goals for the next year. And one of the things that's under discussion is type like presentations or pilot projects that would involve a topic that would attract all generations, but at the same time be moving towards identifying people who are either isolated, debilitated, or have other needs that we might be able to either be a resource for where to go or something like that. One of the things that I wanted to comment on both Kazuki and Juan Manuel's comments was that, yes, we do use a lot of technical ways of meeting people and what's up and webinars and this and that and the other thing. But there is nothing like the personal face-to-face comments. And so it's really important to have that mix so that you don't be isolated at the same time you're within a group. And just last night in one of our board meetings, one of the members said, you know, I want to meet in person the next time because I'm tired of this webinar, this Zoom meeting. So I think those are some of the things that one can do, and we are moving on. It is hard work because you have to always be trying to invent ways of finding out what the community really needs. I'll stop there.
Thank you, Carol, because what you're doing is extremely creative, and we all agree it's a lot of hard work. But you know, when you document what you're doing, I think for WHO, the age-friendly communities need to incorporate this concept of how an age-friendly community differs from other communities by the fact that they are really interconnected into not only a friendly environment, but one of mutual support. So I think, you know, what you're doing actually may be very valuable, and it may be one of those research areas that will help inform other projects that are going on and can benefit from it. I just want to say I lived for 40 years in Miami Beach, and now I live in a community called Jupiter, which is about an hour and a half from where I used to live. And my main concern when I moved was, am I going to find neighbors that I like to talk to? I don't know. It was a big unknown for me. To my surprise, after being in my new home for a few weeks, one of my across the street neighbor knocked on my door and said, "Are you free on Saturday?" And I said, "Oh, yes." She said, "We'd like to have a meet and greet for the community. We want you to meet, and we want people to greet you." So it was very nice. In a moment, I was able to join a group, and he said this was, and we're actually going to this meet and greet is for people of our generation. So all of a sudden, in 1 hour, I met all of the 80-year-olds in my community. And we all had common interests and common things to do, which was actually, again, how a community action can facilitate what we're talking about. So our next speaker, Yvette has family in different parts of the world, and I'd like to have Yvette tell us about her story.
Good day, everybody. And yes, that was very informative. Great experience. Mine is a double whammy situation. I actually retired 25 years ago. I retired early and relocated to a whole new country, not my original home country. So I had a double challenge in that I was going into a strange environment and I was no longer working. So I did use some of Juan Manuel's strategy. I started a consulting business. I was engaged, but I found the church was a whole new community, support community for me. And I did acquire a new skill in that I got engaged in the music ministry at church. I do have a music background, but I never played the organ. So learning to play the organ was a great challenge, and I ended up organist to two churches. So my life there was very full. The community in church was very supportive. But as I started getting older, I have two very elderly relatives. My grandmother died at 94, and I have an aunt who will actually be celebrating her 105th birthday in 2 weeks' time. And I remember my grandmother saying she was losing all of her friends, all of her peers and her contemporaries. And she was afraid of being lonely. And she adopted a strategy, which is what I now use, in that she kept replacing her older, dying social connections with younger and younger connections. So it was with her children's friends and then with her grandchildren's friends. And the 105-year-old aunt is now engaged with her great grandchildren's friends and connections, so that there is always a pool of connections. It's never depleted. And I think that was one of the issues that Dr. Yamuda was referring to when he was talking about losing expectations and having your pool of connections depleted. You can refill it. And it does help doing that. That was one thing. So then now, settled there quite happily for 25 years. Health changes, and my children live all about. Two in the US, one in Australia. No family in St. Lucia, where I'm now living. So they decide I need to be closer to them, especially after COVID. So I moved to Florida. I have to start all over again, making new connections. Fortunately, I'm in a 55 plus community and there's a lot of social activity. So that was a soft landing. But now I found something else. In the community, I'm on the board, and in the community, we not long ago had a person who died, and his loss wasn't discovered. Actually, it's happened twice, until in one of them, it was the postman who realized that the mail was collecting. And in another case, it was the scent. And the thing is, we're a condo, so it's not individual villas. And I realized that there are people here who have no one checking on them all the time to know that you are missed. So we are now in the process of introducing a buddy system where somebody checks on someone else who does not have any family still alive or any family nearby, to check and make sure that they're okay every day. So it's been fun. It's been fun aging. It's also fun. We sit and we chat about our aching bones, the arthritis, the visits to our boyfriends, girlfriends, medical specialists. The last thing I want to add is one of the things I found really rewarding was that I suddenly had a desire to find out where all my classmates from high school were. And we had a 50-year reunion, and we've stayed in touch since then. It's in Trinidad, and anytime anybody visits from overseas, it's an excuse for the whole group to get together and have lunch or dinner. We've been thrown out of restaurants because we're so noisy, but we've stayed in touch. I manage a chat group so that we wish each other birthday greetings. We comfort each other when we've lost spouses. We pray for each other when children are sick. So that too has been a wonderful support. I'll end here.
So thank you, Yvette. Well, thank everyone. But I think what I'm hearing, what I'm getting personally from what you have all said and from my own experience is that we don't have to do it alone. That actually there are ways of creating communities through a lot of different, sometimes through a church faith community, sometimes through our own interest in music or in theater or in whatever. But there is always we need to find those opportunities. Opportunities are there, but they have to be found, and they have to actually be appropriate um, to our own needs, both emotional and psychological. They have to feel good, but we need to find them. So I think what the panel has done is that actually have taken Dr. Kazuki's presentation and made it very real, because you have put, real life stories that show how those connections are created and how those connections actually is not new, maintain and support us in support. So what I'd like to do now is open it up for questions. And I'd like to have people, anyone in the audience who may want to ask a question, to put it in the chat. That's the best way to go about it. So if you have a question, please write it down. I'll read it, and then we'll address that question. I think I don't see any questions, so maybe you have all been so clear that no one has any. Oh, lots of applauses, but no questions, please. Well, I'd like to really ask Carol a question. And Carol, because I think what you're doing in your village is really a model, and I'd like to make sure that it's being recorded and that we actually would it be nice if we develop our own little manual or how to actually make our communities feel like a village? In other words, in a village, everybody knew each other and everybody actually helped each other. So how do we really create, and it doesn't have to be in a large extent of so many people, but how do we really start developing our own little set of steps to help people create their own villages? So, Carol, are you having anyone sort of document and respect to have an ability to help others with that may want to replicate what you're doing?
I think we kind of got into the idea not really understanding the amount of work that it was. And because a lot of our activity was funded by this small grant we've had to put in reports of our activities. However, the kind of information that I think you're asking for is not necessarily something we have collected at this point in time, although, as I say, we're really very beginning because we've only been in existence for a year, so there's still time to start to do those kinds of things. I think that every village defines their own personality according to what they find in that geographical area, because that's what a village is supposed to do, neighbors helping neighbors. And then when you find a lot of the villages have stopped at only doing social things. We had the idea, because we've been able to become a tax-free and entity, that we want to give back and to give more than just organizing social events. We want to identify people who may have needs, like Yvonne pointed out, and that nobody knows them. So I think we'll be, but like any social group, you start with a couple of interested people and you find other interested people, and they are what makes the community group.
Well,
I don't know if that answers your question.
no, you have actually shared your thinking, which is what we're looking forward. I think we may have an opportunity to really create a journal of your venture, and hopefully in the future share the sort of the story of how this village was created, so to incentivize other people who feel the need to do the same to
We'd be
do
happy
it.
to do that. I must also say that at least here in the US, there is a lot of support for this idea. And there are resources available to help villages that are just beginning.
So we have to document that too, and perhaps I think there is a need to really we learn by we learn from others' experiences, and if we really want to promote communities that help each other and connect people towards better health, I think we like to have more stories written, documented, and shared. So I think that might be one of the things that we at FSM might want to actually do, is say anyone who wants to create a village called Cattle. But that might not, you might have to change your phone number. But so it'd be easier just to write the story and give people an idea of what they can do. And so let's go through some of the questions that we have now on the. There is someone said, I am interested to know how we have coped with the social isolation caused by COVID-19 pandemic. We coped by resorting to outdoor activities like community gardens, birding, kayaking. And it's true that belonging to community gardens or to birding clubs or to kayaking groups, all of that are great ways to start connecting to other people. So that's not a question. That's actually more a suggestion, and thank you for that. I wonder whether Dr. Kazuki has anything to add to that.
Yeah, I do actually. I think, one of the, I don't want to say silver linings, because the COVID-19 pandemic was truly awful, and in many ways it's still ongoing, right? But one of the things that came out of it, as I mentioned earlier in my presentation, was that it enabled a lot of people to realize how precious the sort of like ways in which we connect are and encourage a lot of us to go out there and to seek them because we weren't able to access them so easily during the sort of physical distancing measures. So I love hearing about, the framing of the message is coping, which is a little bit, like I prefer, a little bit more positive framing in terms of that. But in a way, it's true. We were all coping during the pandemic. And I, despite the situation, really enjoy hearing about, the activities that people have discovered because they, felt like they had a need to go out and meet new people and meet old people and make new connections, rekindle older connections, maintain them. So sporting, community garden, things like that, we see that all the time. Some of us discovered technology, as someone said earlier, there is a need to be mindful of the essential mix between the online and the in-person. That's really important. But nonetheless, for people like me, for example, that moved around a lot in my childhood, it's really important, the internet for me, because otherwise I'll never get to see them unless I spend thousands of, pounds every month flying to meet people. So the fact that people were a little bit more online after COVID-19 was beneficial for me because I got to catch up with them a little bit more. So different people, I think, have different modalities of connecting, which is the wonderful thing about this topic. Whatever works for you is just let 1,000 flowers bloom, and we love hearing about all of them. And the main thing I think is, in the future, from a public health perspective, how do we, look at that in a way that we can sort of categorize it in a way that we can say, hey, member states, these are the things that you need to be promoting, village work, community work, not just something up there, but things that go down to the community and help people connect with each other.
So there is a question about what region of WHO you think has made greatest progress in this social connection area. Can you?
Yeah.
Can
Absolutely. This is a interesting question, actually, because when we were looking at the issue from like the WHO perspective, writing the report, all of that boring stuff, there are no current measurement mechanisms that is standardized and validated and applicable across all sort of countries. There's no single person or organization, for example, running a survey on social connection. So what we had to do was take many surveys that are being run around the world. There's some in the US. There's one that's global, but only asking a few questions and try our best to bring together the data. So the answer to this question is that there's not yet a data set that allows us to say what's changing because progress means there's a baseline and then you measure what happens after 5 years and then after 10 years. Not yet, there's not data that allows us to say who is making progress. As a snapshot of the data, there is, measures that tell us where is loneliness highest and where is it lower. We know from the data that loneliness and isolation tends to be higher in lower income countries, for example. But does that mean that progress is being made? Not sure yet. It doesn't really tell us which regions are taking the most effort. If you want to take us the way you measure it, which regions have the most policies on social connection? Well, I can tell you that most of the policies, as we saw earlier in the presentation, most policies are in high income countries, mostly in Europe, some in Asia, one in North America. Does that mean that they are the ones that are making the most progress on social connection? Maybe not, because, I know, for example, that there are so many local and community level initiatives that are fostering social connection at local level in, the African region, Southeast Asia, where community is really important. That's not necessarily being measured because no one is thinking to measure it. So long story short, difficult question, not the data available to fully answer it, but I know, and we know, and countries know that it's important to be able to answer it. So we're trying to get member states to agree on a mechanism to measure it long term so that we can say which countries and which regions are doing good work. But that's, I think, a few years down the line.
Well, we're almost with time, but there's a series of conversation in the chat about the fact that political polarization has actually, especially in the United States, but I'm sure it happens everywhere, where in fact political ideologies and political beliefs and positions actually tend to polarize individuals. And it happens in families, it happens in communities, and actually making sure you have a group with whom you feel safe to be and say and think what you want is good. And also learning how to communicate your beliefs and your positions respectfully so that you're not always isolated from others. I know for a fact in my family, we're seven siblings, and two of us are really to the very left, and five of us are to the extreme right, and very few are in the middle, and we still love each other and we still can talk to each other, but we definitely avoid the topic of ideology and politics when we talk to each other. So yes, the polarization in communities, in our own families and communities is something that we need to learn to live with. There is a high level of social connection in social protest I have attended. It's true. I have actually gone to some of those, and I feel immediately in a very good environment. I feel that I want to hug everyone that is there and say thank you for caring about what I care. But so there are different ways. So I think but you're right that certain local issues do not fall in, party lines, and yeah. So there's a long conversation. I invite you all to look at the chat and look at the conversation of how to really you can maintain connection even when you're not totally believing or thinking the same things, but it's easier when you do, obviously. So I communicate a lot easier with my brother, who is as far left as I am, and I communicate with my sister, who is as far right as she can be, but I only communicate with her about her children. Because that's safe. We both love them, so we can talk about them very well. So you find ways of really doing that and living with it as well. I think this has been an extremely interesting webinar. Thanks to Dr. Kazuki's presentation. It has really framed it in a way that we probably hadn't thought before. And I think we have a lot to continue to think, and I really like to encourage everyone to go to WHO website and download it. You can free download the report From Loneliness to Social Connection. And all you have to do is go to WHO website and search for that title, and you'll find it. But I think it's something that you may want to read some more as a way of answering some of the questions that you have that we haven't been able to address right now. So. On behalf of the Association of Former Staff Members, I thank everyone who joined. We will be doing the Healthy Longevity Committee usually does 3 webinars a year. We want to make sure we address issues that are important to our members. So any of the association members who are here, please send us, you know how to do that, some suggestions of what are the issues that you would like us to address in the future. And thank you, Dr. Kazuki. It's been a pleasure to hear you. It's been very interesting to get the perspective and the context that WHO using to actually promote social connection as a public health intervention, as a public health priority. And I think we all have different ways of thinking about it, thanks to your presentation. Thanks to Juan Manuel and to Carol and Yvette for having shared their own experiences. I hope that everybody has seen in each of those experiences a little bit of opening to what you yourself can do, how you can actually move on with creating your own safe community around where you are. So with that, I think we have come to an end of our, it's 12:29, so we have come to the edge of our hour and a half window. I think you can actually copy the comments if anyone wants them, and see you in a month or two.
Thank you very much, everyone.
Bye-bye.